A very good afternoon, everyone. Welcome to TAJA's COVID-19 Vaccine Awareness Webinar. With the recent information that we have about the COVID vaccine, I'm pretty sure everyone is eagerly waiting to get more and more information about the COVID vaccine. With that keeping in mind, TAJA is presenting you a webinar where you would get to know answers for a lot of the questions that you're looking for. Before we kick off the program, let's welcome our president, Paparav Gumrapugaru from TAJA for 2020 and 2021 to give his welcome notes.
Hello, everyone, for all the TAJA members and everybody living here in Jacksonville. We arranged this TAJA COVID-19 vaccination awareness webinar by Mr. Dr. Praveen Cherupalli garu. This is not only helpful for Telugu community, but this is helpful for everyone in the Jacksonville community and Florida overall. So we wanted to have this webinar, in English, and we're going to record this webinar for people who are going to miss it. So we'll have it in YouTube, and also it's being live on Facebook right now. And we're not yet done with the pandemic, as you know. For the last 1 year, we're in this pandemic, and we're still going. And good news is we have some vaccination available, which will help us. But until everyone gets vaccinated, we're not safe yet. So we just wanted to bring the awareness of the vaccines and that are available, and the schedule and everything like that for everyone's benefit. With that said, I would like to thank Dr. Praveen Cherupalli garu for accepting to come and speak present on this webinar. And Naveen, you can take it from here.
Sure. Thank you, sir. Once again, welcome to our webinar. We do have a very distinguished speaker who is going to present on the COVID-19 vaccination. A little bit of background about our speaker today. Dr. Praveen Cherupalli garu has a vast experience in the area of internal medicine, and I'm pretty sure his qualifications and especially his academics and credentials are definitely way longer than my name. He has got expertise in every field of research that I could think of. He has his degree from University of Illinois, and he also received an MBA from University of Massachusetts. Before moving to Winter Haven, Dr. Praveen was a resident here in Jacksonville, Florida, and now he is working as a medical director for the medical hospital at Winter Haven in Winter Haven, Florida. Outside of being a doctor, Dr. Praveen, in his free time, if he gets any, he is an avid photographer, he teaches yoga, and he also writes a lot of journals and research papers for medical journals. With that being said, Dr. Praveen, we welcome you and looking forward for your webinar. And a quick note for the audience, if you do have any questions, please use the chat in Zoom or using our Facebook Live. One thing I would like to mention is that we will have a continuous flow of the presentation because we are pretty sure most of your generic questions might be answered in the course of the presentation. If we still have any more questions left that you would like to, we would definitely review the chat session and we will take the Q&A from you. With that, help me welcome Dr. Praveen Cherupalli for COVID-19 vaccination. Dr. Praveen, over to you.
Yeah, thanks, Andy. Thank you, Naveen garu. Good afternoon, everyone. Again, I'm Dr. Praveen Cherupalli. Thanks to Paparav garu, thanks to TAJA for this opportunity to come in front of you and talk about COVID-19 vaccine. This is a very important topic nowadays, not just here in the United States, but all across the globe. So without wasting any further time, let me jump into the presentation right away. As Naveen garu mentioned, Your questions might be answered during my presentation. And at the end of my presentation, I actually have a bunch of frequently answered questions listed, and your question might be answered there. If not, please feel free to post your question at the end of my presentation. Navin Gauri, can you see my slides?
Yes, sir. You're good to go.
Excellent. All right. Okay. So, before I start with COVID-19 vaccination, I just want to make you all aware how rapidly these vaccines were developed. So on an average, a vaccine takes about 10 and a half years to come into the market. So the average vaccine time is 10 and a half years before it comes into the market. The shortest time before COVID-19 vaccine, the shortest time a vaccine took to come into the market was Ebola vaccine, and it took 5 years to develop that vaccine. So considering all of that, COVID-19 is probably, you can imagine how fast it was developed. So it was developed just within few months. The COVID vaccine trial started back in April, May, and in about 6 months' time, they developed this vaccine. So the reason why I want to bring this up, because it takes 10 and a half years. The reason is extensive research goes behind developing a vaccine, especially to establish safety protocols, to develop what dose you need and how many boosters you need and how long the immunity lasts, what kind of reactions you develop. So a lot of safety trials go into behind developing a vaccine. So with COVID-19 vaccination, with an intention to bring vaccine sooner into the market, 10 and a half years versus 6 months, a lot of protocols became emergent. So a lot of protocols were not implemented as they were supposed to. So it is still ongoing. A lot of data is still pending, especially a long-term efficacy of the vaccines, long-term side effects of the vaccines. So they are still, the studies are still ongoing. Having said that, these vaccines are one of the most efficacious vaccines in the market. When compared to flu vaccine, the efficacy is only 40 to 60%, whereas with COVID-19 vaccines that we have in the United States, the efficacy is about 94, 95%. So as you can see here, there are several vaccines in the world. In the United States, we'll focus on the vaccines in the United States. I'll briefly talk about Bharat Biotech vaccine as well. So right now we have two vaccines, Pfizer BioNTech and Moderna vaccine. So these two are approved under emergency use authorization by United States. And the next two vaccines that are available, that will be available in the market, are Johnson & Johnson vaccine and Novavax, that recently completed the phase 3 trials. And down below there, you'll also see Bharat Biotech vaccine. Bharat Biotech is actually a huge vaccine producer in the entire world. So their vaccine, Covaxin, also is going through phase 3 trial right now. Bharat Biotech recently partnered with Ocugen company in the United States with the intention to bring Covaxin in the United States as well. So Pfizer vaccine. So Pfizer was the first company to develop a COVID-19 vaccine, to actually bring the COVID-19 vaccine into the market. As you can see here, their efficacy is 95%, which is pretty huge. And to be honest with you, the efficacy may not be at 95% in the market. So during the studies, the efficacy was 95%. But once it in the market, it may or may not be around 95%. It may actually drop down. And the main reason is, when the studies were conducted, everyone was still very careful. Everyone was still maintaining social distancing, wearing a mask. Everyone was very careful. So the chances, the possibility of getting COVID-19 during the study was lower. But nowadays, post with the holidays, with all these gatherings, people coming together, efficacy may drop, may be lower. You need 2 doses, both with Pfizer and Moderna. With Pfizer, it's 3 weeks apart. It's a simple muscle injection. A big difference between Pfizer and Moderna is the storage. So here you need a minus 94 degrees Fahrenheit to store Pfizer vaccine. So logistics are cumbersome with Pfizer vaccine when compared to Moderna. Moderna, you can store it in regular refrigerator. So Moderna vaccine efficacy, again, 94.5%. You need 2 doses. It's 4 weeks apart. And again, muscle injection. So refrigeration here is just minus 4 degrees. And with a regular refrigerator, you can actually store it for 30 days, which is logistically, it's actually much more convenient when compared to Pfizer vaccine. Both Pfizer and Moderna vaccines, they both are mRNA vaccines. mRNA is nothing but a messenger RNA. A messenger RNA carries genetic information to produce a protein. So this mRNA carries genetic information regarding the spike protein. Spike protein is, as you can notice here, there are spikes on this virus. And basically it's called as coronavirus because of these spikes. And the mRNA carries information regarding this spike. And when the vaccine is injected into our body, or this mRNA gets into our cells, it does not get into the genome, the DNA of the cell. It just gets into what we call it as cytoplasm. It gets inside the cell and it starts producing the spike protein of the virus. And as spike proteins are produced in our body starts reacting to the spike proteins and builds immunity in our body. And it starts building antibodies in our body. And when we get vaccinated, when our body starts reacting to the spike proteins and start building immunity, and the signs of building immunity are fever, body aches. These are actually natural signs that your body is actually reacting to the spike proteins and building immunity. As you can see, there are actually other proteins as well. There are other vaccines that are developed against other proteins and other nucleic acid proteins, envelope protein, but most of the vaccines are actually developed against spike protein. And the Bharat Biotech vaccine, Covaxin, is actually, it's inactivated vaccine. The entire virus is injected. It's not just the spike protein. Contraindications and precautions. I want to talk more about this contraindications and precautions. It's extremely important because if you have any of these conditions, it's better not to get the vaccine. Severe allergic reactions. So if you ever had any severe allergic reaction to any other vaccine in the past, you may have to be cautious. It's better to avoid COVID-19 vaccine. If you have what we call it as anaphylaxis, anaphylaxis is a condition where you start developing swelling of your face, lips, throat, and your airways kind of literally constrict. If you developed anaphylaxis or any other severe allergic reactions in the past, please avoid COVID-19 vaccine. And if you develop any severe reaction to the first dose of COVID-19 vaccine, again, avoid the COVID-19 the second dose. So any severe reactions, severe allergies, seasonal allergies are okay. If you have mild allergies, they're all okay. Mild to moderate allergies, but it's primarily severe reactions. If you developed severe reactions anytime in the past to any vaccine, it's better to avoid these COVID-19 vaccines. The precautions: history of an immediate allergic reaction to any other vaccine or injectable therapy, moderate to severe acute illness. If you have active illness, if you have active COVID-19 infection, if you have active infection going on, any infection, it's better to avoid vaccination. A little bit more about Pfizer vaccine. As I already mentioned, 2 doses, 3 weeks apart. It is indicated for 16 years and older. Second dose, you need to take it 3 weeks apart, but depending on the schedule, depending on when you get the second appointment, you can prepone, you can advance it for about 4 days before the recommended second dose. And to be honest with you, it's always better to postpone the dose rather than prepone the second dose. So if you take one dose today, and if your second dose is supposed to be 3 weeks later, it's better to take on the 21st day, 22nd day, or little few days later. If your schedule does not permit, you can actually schedule it a few days later. It's better to schedule it a few days later than to schedule it a few days before. But the recommended is only up to maximum of 4 days before the recommended date. You should not go lesser than that. The second dose should be administered as close to the recommended interval as possible. However, there is no maximum interval between the first dose and second dose. The second dose, you can take it 4 weeks. The recommended is 3 weeks, but you can take it 4 weeks, 5 weeks, 6 weeks, 8 weeks later. There is no maximum interval, recommended interval, but try to keep it as close to 3 weeks as possible. And if you received any other vaccines, do not take COVID-19 vaccine for at least 2 weeks after you received the other vaccine. So you need to have at least a 14 days gap after you received another vaccine. Moderna, this is indicated for 18 years and older. Pfizer is 16 years and older. Moderna is 18 years and older. The same thing, you need 2 doses, but this is 4 weeks apart, 28 days. Pfizer is 21 days and Moderna is 28 days. The second dose, again, you cannot take it. You don't want to take it 4 days, beyond 4 days before the second recommended dose. So you should not prepone it, advance it by more than 4 days. Second dose, there is no maximum interval, the same thing as Pfizer vaccine. And if you received any other vaccines, again, the same thing, you should wait for at least 2 weeks after you received another vaccine. So what to expect after the vaccine? You may have heard about some dreadful stories out there. You may have heard some people saying that they did not have any reactions. So the serious allergic reactions, anaphylactic reactions, are very rare. So it's actually 0.5 or 0.6% or less. So they're very rare cases of severe allergic and anaphylactic reactions. So given that, this vaccine is pretty safe. As long as you don't have severe reactions, you are pretty safe. And even though severe allergic reactions happen, when you have other allergies, other associated allergies, if you have other severe nut allergies or allergic reactions to pollen, severe allergic reactions to something else, that's when you may develop severe anaphylaxis to this vaccine. But if you're healthy, if you never had any allergic reactions before, the probability of getting severe allergic reactions to this vaccine is extremely rare. So the common side effects, these are very common, and you will see these side effects pretty much in most of the people that take vaccine. The common side effects are pain, soreness at the site of the injection. These are very common. Pretty much everyone has pain and soreness at the site of the injection. Most of the people, they try to get in their left arm. That way, their work is not obstructed. And the other common side effects are low-grade fever. Fever is very common. Mostly it's a low-grade fever. However, you may even have high-grade fever. Body aches, not just feeling good, just the feeling of, feeling sick, fatigue, weakness, tiredness. Headaches are very common. Dizziness is very common as well. Dizziness, you see it in a lot of individuals. Just flu-like symptoms. Basically, these are all flu-like symptoms. Fever, body aches, feeling sick, chills. Developing flu-like symptoms. So these are the common side effects that you see with this vaccine. In fact, these are exactly the same symptoms that you have when you have COVID-19 illness. If you have COVID-19 mild symptoms, These are exactly the same symptoms. You feel exactly the same way. You feel as if you have another COVID-19 infection in a milder way. And these are quite often and quite common, nothing to be concerned about. So if you have any of these side effects, and you need to expect them even before you get the vaccine, expect to have these side effects, and there are nothing really to be concerned about. The side effects, they last about 24 to 48 hours. So here is the thing, this is extremely important to remember. These side effects are common. However, they don't last longer than 48 hours, maximum of 72 hours. So I've seen so many people. Actually, one of my colleagues, he got his first dose of vaccine. Actually, I have two colleagues, two physicians, who got their first dose of vaccine, and they developed a COVID-19 infection after they received the first dose of vaccine. So for the first 2 days, almost 3 days, they thought it was all because of the vaccine itself. So usually the side effects due to vaccine don't last beyond 48 hours, maximum 72 hours. If your symptoms continue beyond 72 hours, then yes, you need to call a doctor. So the symptoms are exactly the same like COVID-19 infection. So there is no way that you can differentiate if it is an active COVID-19 infection or if it is due to vaccine. So the differentiating factor is the duration. You will have these symptoms for about 24 to 48 hours. 48 hours later, they usually fade away. You should not have symptoms. Maximum 72 hours. After that, definitely you should not have any more symptoms. However, if your symptoms last longer than 2 to 3 days, you need to call your doctor. You need to be concerned about some infection. And there are cases where people actually developed not COVID-19, but different type of infection. Actually, there was a case that was reported in Andhra Pradesh. Patient actually had a typhoid infection. Patient did not die because of COVID-19 vaccine. Patient actually died because of typhoid infection. So it's entirely a different scenario. It can happen. Coincidence can happen when you are giving this vaccine to millions of people. Coincidental infections are quite common. There were actually Bell's palsy, facial paralysis that happened during the trials itself. That was not again because of the COVID-19 vaccine. The general incidence in the population, the general incidence is exactly the same as that was reported in the studies. So there are a lot of coincidental things that might happen that may not be related to the vaccine itself. But just remember, just be cautious. The symptoms do not last longer than 48 hours, definitely not more than 72 hours. If you have symptoms more than 72 hours, then you need to be cautious. You need to call a doctor. And younger adults usually have more symptoms than older adults. It's just because of their body habitus. It's just because younger adults may mount more immunity than older adults. And people who are immunocompromised, people who have infections like HIV or other immunocompromised states, they may not have as severe symptoms as healthy adults, because it's just because when the reason why you have these symptoms is it means that you're actually building immunity in your body, you're mounting immune response in your body. That's why you have these symptoms. So when you don't have these symptoms, and again, I don't think you are not mounting infection. It's also quite common that in young adults or any other adult, you may not have any symptom at all. But in general, this is a general statement, younger adults have more symptoms than older adults. And side effects are usually more pronounced after the second dose. If first dose, usually side effects are not too much, but after you receive the second dose, then expect to have more symptoms. And if you had a COVID-19 infection in the past, then expect to have more symptoms even after the first dose. People who were affected by COVID-19 in the past, in general, have worse symptoms than people who never had COVID-19 infection in the past. So what to do? You don't have to take Tylenol or ibuprofen before you get the injection, but after you get the injection, if you start feeling fever, chills, body aches, you may or may not, if you don't have any symptoms, that's good. But if you start feeling fever, chills, body aches, just that feeling of sickness, then start taking Tylenol and ibuprofen. Start with Tylenol first. If it is still not effective, then you can alternate Tylenol and ibuprofen. You can actually take I was taking Tylenol when I got COVID-19 infection, first of all, and my symptoms were really worse. For 2 days, I was completely down. I was taking both Tylenol and ibuprofen alternately about every 4 hours. Tylenol, ibuprofen, Tylenol, ibuprofen. Start with Tylenol. If it is still not effective, then you can take ibuprofen as well. Drink plenty of fluids. I've seen a lot of people getting vaccine who feel dizzy, lightheaded. In fact, I actually passed out when I got my second dose of vaccine. So drink plenty of fluids, keep yourself hydrated. And at the site, at the injected site, if you have any soreness, you can use a wet cloth or a cool cloth over the injected site if you have any soreness. Usually soreness is not that bad, but it's mostly the fever, chills, body aches. It's just that feeling of sickness that bothers you. And if possible, see if you can get the vaccine on a Thursday or a Friday so that you get a weekend off, especially for your second dose. And I've seen so many people, in fact, more than half of my team, they could not work after they got their second dose. You want to take a day off if it is weekday, or you better take it on a Thursday or Friday. That way you get a weekend off, because don't plan to have any serious matter, or don't plan to have any important tasks when you get the second dose, because you will not be able to focus. So just see if you can take one day or 2 days off. Be prepared. At least be prepared. If you don't have symptoms, that's fantastic. But you never know. You may have really worse symptoms. You may have to take 1 or 2 days off. When to call the doctor? So whenever you get the vaccine, they will make you sit at the vaccination site for 15 minutes. They don't let you leave. So they have to observe you for at least 15 minutes, because almost all severe allergic reactions, they occur within the first 15 minutes, or usually within the first half an hour, definitely. So anaphylactic reactions, severe allergic reactions usually occur within the first 15 minutes. So you have to be there on site wherever you get the injection. You have to sit there for 15 minutes under observation. So as I mentioned before, if your symptoms persist beyond 72 hours, so if you have persistent fever, body aches, any other symptoms beyond 72 hours, it's better to call the doctor. If the redness, swelling at the injection site is worsening, usually it should slow down. You may have you start having some pain, redness, not much redness, but usually pain and swelling, usually a few hours after you get the first dose. It usually starts about 8 to 12 hours after your first dose, and then the soreness and the swelling may last for about 24 to 48 hours. However, occasionally, or rarely, if this pain, soreness, swelling, redness, if these symptoms continue to get worse, 48 hours, 72 hours, if they're actually getting worse, then yes, you may have to call a doctor. Sometimes you may develop some infection, local infection at the injection site. It may happen, rarely. So then you may have to call a doctor. And if you notice any other allergic reactions, and I listed a few of the common allergic reactions: shortness of breath. Shortness of breath, it may happen. Usually it happens along with the severe allergic reaction, but if you develop it a day later, 2 days later, worsening shortness of breath, swelling of the lips or tongue, hoarseness of the voice. Hoarseness of the voice again happens when the airways constrict. When your airways constrict, when you're not able to breathe properly, then you develop hoarseness of the voice. Skin reactions. There's beehives kind of skin reactions. It's called as urticaria. Is if you develop any bad itching, hives on your skin. These are all actually signs of severe allergic reactions, and typically they occur in the first 15 to 30 minutes. However, rarely they may occur in the first 1 or 2 days. So if you notice any of these severe allergic reactions, please call the doctor. So next question is another common question that I get: which vaccine is better, Moderna or Pfizer? So I just wanted to put this table here so that you can see the differences between these two vaccines. Both the vaccines are mRNA vaccines, and you need 2 doses with each. Efficacy is pretty similar: 95%, 94.1% efficacy is really, really high. As I mentioned as I mentioned before, flu vaccine efficacy is only 40 to 60%. Compared to that, this efficacy is super high. Severe reactions are pretty similar again, almost 6.2 cases per million doses for Pfizer. Moderna is 2.1 cases per million doses. Pregnancy, if you're pregnant, then you can definitely get COVID-19 vaccine, but there is a small caveat. These vaccines were never actually tested in human beings. Pregnant human beings. They were tested only in pregnant animals. That caveat is there. But both CDC, IDSA, they all recommend vaccines for pregnant people as well. Durability of protection, nobody exactly knows the durability, how long the immunity lasts. Nobody clearly knows because the vaccine was just developed a few months ago. And that's all we have. The data that we have so far is just for a few months worth of data. We don't have years worth of data here. So nobody really knows exactly. But the expectation is few years for sure. So putting all these factors together, in fact, no one vaccine is superior than the other. If you have Pfizer or Moderna, it doesn't matter. Getting the vaccine is actually more important. So ultimately, the conclusion is whichever vaccine you have, you can get it. And one thing actually I missed putting it here, both the vaccines, they are effective against the UK strain. The new UK strain, both the vaccines are effective. Not so much on South African strain, but UK strain, they both are effective. And we have so many other new strains that are coming now. We really don't know the efficacy against every strain out there, but the expectation is because these two, the mechanism of action is pretty similar, so the efficacy is pretty similar. The action, the efficacy against the new strains should be pretty similar. So the next question that we get very often is, when is my turn? So it's difficult to know when is your turn. Obviously, if you are a healthcare provider, if you touch patients, if you provide direct patient care, you should have gotten your vaccines by now. Pretty much every hospital in the country have been administering the COVID-19 vaccines. And now COVID-19 vaccines are there in Publix, CVS, Walmart pharmacies. If you are a healthcare provider meaning any provider who gets in contact with patients, you should have gotten your vaccines by now. If not, there are still plenty of vaccines out there. Please go get it. If you're not a healthcare provider, the next, as you can notice here, the next priority is individuals above 65 years of age. So the first priority is healthcare providers, and it's not just healthcare providers, but frontline people, police, or there are so many other frontline people. So if you're a frontline worker, you can get a vaccine, but if you should have already gotten your vaccine by now. And the next priority is for individuals above 65 years of age. If you are above 65 years of age, you can schedule a vaccine dose now. Even if you are from India, even if you are not a citizen here, you should actually schedule the vaccine. You should have gotten your first dose by now. If not, please go ahead and schedule your first dose if you are above 65 years of age. Long-term care residents, nursing home residents, assisted living facilities, they all can schedule a vaccine. Individuals deemed extremely vulnerable, individuals who have HIV or syndromes like Down syndrome. They're vulnerable people who can also get vaccinated, who can also schedule a vaccine now. I've listed a few websites here. You don't actually need to go. I mean, you can just Google COVID-19 vaccine Publix pharmacy. You can directly go into their website and you can start scheduling a vaccine. You can directly go into COVID-19 vaccine, COVID-19 vaccine CVS pharmacy, COVID-19 vaccine Walmart, or Florida Department of Health. Florida Department of Health COVID-19 vaccine. They have extensive information, tons of information regarding COVID-19 vaccine. So if you I also listed a few phone numbers here for Duval County. You can see the phone number, but the best way is just Google COVID-19 vaccine, Florida Department of Health, or COVID-19 vaccine, Publix pharmacy. I actually checked, I was just checking it yesterday. They don't have any appointments yet. I think as soon as they open the appointments, they're booked just within half hour or 1 hour. I think they're releasing appointments only week by week, if I'm not wrong. So I'll give you a few tips before I go into frequently asked questions. I'll give you a few tips. Don't quote me anywhere, please. This is only for TAJA people. So if you work for Blue Cross Blue Shield, you are considered as a healthcare provider. So again, you don't have direct patient contact. It's okay. Schedule an appointment, go to Publix pharmacy, schedule an appointment. If they ask you, you tell them I work for a healthcare company. And they say, which company? Show your ID card, Blue Cross Blue Shield. And if they still ask you a question, do you have direct patient contact? Say yes. So you will be eligible. You are eligible. You can actually get a vaccine. I have so many people. Actually, I have a friend who works for auto insurance company. Waterford, I guess, auto insurance company that also has healthcare products. He already got his 2 doses of vaccine along with the healthcare workers. So if you work for any healthcare company, it's not just hospital. You may be working for any healthcare company, you'll be eligible. Only thing is, when you try to schedule an appointment, the first question will be, do you have direct patient care? So just check the box. It's okay. Nobody is actually closely checking everything, every documentation. In fact, I have so many friends in my community who have nothing to do patient care, nothing to do with healthcare companies. They all got vaccines. I have several Gujarati people here. They pretty much more than half of the people in my community got their both the doses of COVID-19 vaccine. I don't want to go that extent, but if you're working for Blue Cross Blue Shield or any other healthcare company, any other company that produces healthcare products, you'll be eligible. And just go say, if they still ask you questions, just say yes, I have direct patient care. Nobody's checking anything. And if one public pharmacy is so strict that they don't allow you, go to another pharmacy. There are so many other pharmacies out there. And there are a few other tips that I can give you. Let's say if you have nothing, you're not a healthcare provider, you don't work for a healthcare company, you're not above 65 years old, you're a young guy. So at the end of the shift or right before the store closes, so whenever you open a vial, you should give all the vaccines. Each vial has at least 5 doses. So you should administer all the 5 doses. Otherwise, you cannot use that vaccine vial for next day. So what happens, let's say if there is a public pharmacy, they're about to close, and if an appointment got canceled, or let's say they are done with all their appointments, but they gave only 3 doses out of 5, they still have 2 doses left in the vial. So what they typically do is they just discard it. So if you are there right before the store closes, if you are there at public pharmacy, you may get lucky. I'm not saying they will give you for sure, but you may get lucky. They may call you to get because nobody wants to waste a dose. So if you are there available, they may be willing to give you that dose. So if you really want to get the vaccine, and if you don't belong to any of these categories that I mentioned, try your luck. Just go visit Publix pharmacy. You don't even have to schedule an appointment. If you're going for groceries, just go try your luck. Be there. the last 5-10 minutes of the right before the pharmacy closes. Just ask them and see, if they still have any doses left. You may get lucky because it happens quite often. Pretty much every single day, appointments are canceled. So when appointments are canceled, they don't have anyone else to give. So if you are there, if you approach them, and I've seen actually a lot of my friends who waited in the pharmacy for 1 hour, 2 hours, and because they just waited, by the time the store was closing, they gave the vaccine doses to them and they left. So you may get lucky. So if you really want to get the vaccine and give it a try, you may be able to get vaccines. Now, frequently asked questions. Can pregnant women receive COVID-19 vaccine? As I mentioned, yes, you can get vaccine. However, there are no studies, but it is recommended for pregnant women. You can get either Pfizer or Moderna vaccine. Can lactating women receive COVID-19 vaccine? Again, yes. No studies are done yet, but it is considered safe. I had COVID-19 infection. Do I still need to get the vaccine? Absolutely. I had COVID-19 infection myself. I still got my 2 doses of vaccine. And the reason is natural immunity, especially if you have mild infection. Mild infection, natural immunity does not last longer. In few studies, it lasted only for 3 to 4 months. So the natural immunity may not last longer than 1 year or 2 years. Nobody knows yet. But in a lot of studies, especially if you have milder infection, natural immunity did not last long. If you had moderate to severe infection, your natural immunity may last a little bit longer. So if you have COVID-19 infection, you still need to get the vaccine so that the immunity lasts longer. Next question, when should an infected person receive COVID-19 vaccine? If you have COVID-19 infection now, you can wait up to 3 months. There are no clear guidelines again, but you can still get the vaccine 4 to 6 weeks after your COVID-19 infection. It's okay, but it's better to wait for 90 days because you will definitely have immunity for 90 days for sure anyway. So you can get your COVID-19 vaccine after your 90 days after your infection. Next question, what if you get infected right after receiving the first dose of COVID-19 vaccine? So if you get infected right after receiving the first dose, you have few options here. This section is a little bit confusing, depending on how your infection is. If you have mild infection, if you only have mild symptoms, then you can still get the second dose 4 to 6 weeks later. However, if you have moderate to severe infection and if you received plasma therapy or if you received monoclonal antibodies, then you have to wait at least for 90 days. So if your infection is only mild infection, you can get the second dose 4 to 6 weeks later. 4 to 6 weeks after your infection resolves. If you received any plasma therapy or any monoclonal antibodies, then you need to wait for at least 90 days. Next question, can individuals with cancer, chemotherapy, drugs, immunocompromised status like HIV receive COVID-19 vaccine? Yes, you should definitely receive COVID-19 vaccine. You are considered as vulnerable, and all vulnerable individuals are eligible to schedule their COVID-19 vaccine now. Next question, can I take flu vaccine at the same time of COVID-19 vaccine? No, as I mentioned earlier, there should be at least a gap of 14 days if you received any other vaccine. So get a COVID-19 vaccine only 2 weeks after you get any other vaccine. Next question, does COVID-19 test become positive after receiving the vaccine? No. Even after you receive the vaccine, COVID-19 test will not be positive. Antigen test will not be positive. And even the PCR test will not be positive even after you receive the COVID-19 vaccine. Next question, can you get COVID-19 infection even after receiving 2 doses of the vaccine? Yes, there is a possibility for sure. Remember, the efficacy is only 94-95%. So, that 5 to 6%, there is a possibility. And honestly, I don't think the efficacy will be 94-95%. It was 94-95% in the studies. I don't really expect it to be 94-95% in the market. So because the efficacy is not 100%, there is still a possibility that you can get COVID-19 infection even after receiving 2 doses. And remember, there are so many other strains out there, newer strains, and we don't know if these vaccines are efficacious against other newer strains. So as of now, things might change eventually. So once everyone gets vaccinated, once the pandemic is over, it may end up like any flu vaccine, where you get a flu vaccine every year. It may be something like that. We don't know yet. However, at least until the pandemic is over, everyone should get 2 doses of vaccine, and we should still maintain social distancing, and we should continue to wear a face mask, because there is still a risk of getting COVID-19 infection even after you receive 2 doses of vaccine. The next question, I think I answered this. Do you still need to wear a face mask and maintain social distancing after getting vaccine? Yes. Again, for the same reason, because the vaccine is not 100% efficacious. And the second thing is there are several new strains, and we don't want to be infected with the new strains, because we don't know if these vaccines are efficacious against all the new strains. Next question, can I travel after receiving COVID-19 vaccine? You may travel, but please still take precautions. Especially if you're taking a long flight going to India, you're still at risk. So whenever you're traveling, whenever there are gatherings, still be careful. Still wear face mask. Try to maintain social distancing, hand wash as much as possible. Next question, can you receive COVID-19 vaccine if you're treated with monoclonal antibodies or convalescent plasma? Yes, but you need to wait for at least 90 days after the vaccine, after the convalescent plasma or monoclonal antibodies are administered. Next question, are vaccines effective against new strains? So we definitely know that Pfizer and Moderna vaccines are effective against UK strain. And we also know that they are less effective against South African strain. So these two strains are studied already. However, we don't know. There are so many other new strains coming. We don't know if these vaccines are effective against all other strains. And believe me, there will be more and more newer strains that will be emerging. Just like flu, the reason why we get flu vaccine every year, because the strains vary. Every year you have newer strains. That's why you have new vaccine, flu vaccine every year. So coronavirus will be something similar. There we may end up taking COVID-19 vaccine once a year if we get more and more strains. Covaxin is effective against a UK strain. It is effective against 2 or 3 other strains that were studied as of now. Again, Covaxin is not studied against all the strains yet. Only difference between the biggest difference and why Bharat Biotech is more hopeful, because Covaxin is inactivated vaccine. So the entire inactive virus is injected into our body. So the hope is we may develop immunity against the entire virus, all the proteins that I just described before. So we may develop immunity against the entire virus. Whereas with the Moderna and Pfizer, it's just a spike protein that's injected into our body. So we develop immunity only against the spike protein. If the newer strain does not have the same spike protein, if the spike protein is entirely different, then these two vaccines will not be effective. However, with Covaxin, you may still have some immunity against other proteins in the virus. There are so many other proteins, envelope protein, nucleocapsid protein. So you may still have some immunity. Again, until it is studied, nobody really knows, but it's just a hope. And that's what Covaxin is using to market themselves. Next question, are unvaccinated children safer once parents and school teachers receive vaccine? This is a common question. COVID-19 vaccine is not available for children yet. The studies are ongoing as of now. And I think even in the studies, they did not include, if I'm not wrong, only 6 years or 7 years or older kids are included in those studies. So if you have young kids, they will not be getting the COVID-19 vaccine. However, once all the parents, once 60-70% of the population gets vaccinated, they are definitely safer. If all the teachers and parents get vaccinated, kids are definitely safer. If parents get vaccinated, their kids, the risk of kids getting the infection is much lower, because it's usually the parents who are going out into whether it is for shopping or wherever it is. Usually it's adults who are going outside more than the kids. So usually, if adults are getting vaccinated, then the risk of kids getting the infection is lower. And remember, infection in children is much more milder and much lower risk than infection in the adults. So even if kids get infected, usually it resolves right away. They don't really have the severity of illness is much lower in children. I mean, some of them, if you're not lucky, of course, you may have some severe illness even in children. But in general, children are at much lower risk for COVID-19 infection. Next question, do we have to take COVID-19 vaccine every year? As I mentioned, that may happen. Nobody knows yet. If we have newer and newer strains emerging, and if the existing vaccines are not effective against the newer strains, then they may recommend to take COVID-19 vaccine every year. Next question, how long does the immunity last after taking the vaccine? Still under investigation. We still don't know yet, because all these vaccines are studied only for a few months. So we don't really have enough data to confirm how long the immunity lasts. So the expectation is for a few years at least, because we are getting 2 doses. The expectation is for the immunity to last at least for a few years, but nobody clearly knows exactly how long. Next question, can I take ibuprofen or Tylenol after the vaccine? Absolutely. You can definitely take Tylenol. There was a small article released by CDC that there were some concerns about ibuprofen. Nothing is confirmed yet. Evidence is not strong. In fact, similar concerns were raised back in February or March when we were treating COVID-19 patients with ibuprofen. It's exactly the same concern even then. They said ibuprofen may worsen COVID-19 infection, but CDC came back and clarified and said ibuprofen can be used. It's exactly similar concern here, so you don't have to be really worried about. Start with Tylenol after you take the vaccine. Take Tylenol if you think it's not effective. Definitely take ibuprofen. I actually had to take both Tylenol and ibuprofen myself. All right, I think that's all I have, and I will open the floor for questions.
That's definitely a lot of good information, Dr. Praveen. I'm pretty sure you have been covering this actively across many audience, and you've been a part of this COVID since the beginning of the pandemic through the inception of the vaccine and all the side effects. Just a quick note for all the audience: if you do have a question, please send your question on Facebook live chat, or you can just type it on a Zoom chat. Dr. Praveen, we do have a couple questions that came in via both our channels. The first question is kind of a generic, so it's 2-part, but I'll still read both the questions for you. The first question I got was, I know the vaccine is pretty much preferred for citizens over 65. Is there a specific preference for a general population, especially from the age group from 60 to 65? Any idea when that is going to be available?
So in the United States, it's everyone else is equal if you are below 65. So there is no specific preference if you are between 60 and 65. In India, it may be different. I think in India it may be above 50. I think that's what they are considering in India. But in the United States, it's above 65. So if you are between 60 65, there is no difference between 60 65, or if you are below 60, there is no specific difference. However, as I mentioned, as you get closer to 65, especially if you have risk factors, the thing is, if you are 60-year-old, if you have hypertension, diabetes, heart problems, lung problems, then you are vulnerable. You are at risk. So hopefully, people like this should be vaccinated sooner than later. They should definitely get a priority. The challenge is it's difficult from logistics point of view. Once you say below 65-year-old, then you're opening the vaccines for the entire population, because you may have 30-year-old with hypertension, diabetes, you may have 60-year-old with hypertension, diabetes. So now you'll have millions more to get vaccinated. So it will happen very soon. That will be the next step. But as of now, it's only 65 or older.
Got it. And that was my follow-up question. That was the next question. When is it expected for the general population? So
it will come up very soon. I mean, to be honest with you, the way they started this vaccination program, it was so quick. I was super impressed. I was impressed with the logistics. It's not easy. However, the progress has been really, really slow, extremely slow. They started at a really fast pace, but it slowed down significantly. I mean, we thought pretty much 70% of the population would be vaccinated by August, but now, Biden is saying, hopefully by next Christmas, hopefully by Christmas. So the pace has slowed down significantly. It has been really slow, but they go by the priority, above 65-year-old, and then vulnerable population, and then below 65-year-old.
perfect. Thank you. Another question just came in. This is more of a logistics. Is the vaccination covered by most insurances, or how is this working at the moment?
Yep. So all the vaccines, the COVID-19 vaccine is definitely covered by the government or by your insurance. You don't have to pay anything. So far, actually, it has been the government. So a slight difference is, so far until last week, actually, the Department of Health, they released vaccines to the hospitals. So they released vaccines to the hospitals, and we were administering these vaccines to general population. So first of all, they administered vaccines to healthcare providers in the hospital. And once all healthcare providers were vaccinated, they opened it for general population above 65-year-old. So all the hospitals in the state of Florida, we were actually giving this, administering this vaccine to above 65 years old until recently, until last week. And then now, Department of Health started releasing these vaccines not to the hospital, but to pharmacies, CVS, Publix, or Walmart pharmacies. So now I think most of the hospitals, they are slowing down, and pharmacies are picking up. In the next few weeks, you'll see more and more vaccinations at Publix, Walmart, or CVS pharmacies.
Perfect. Thank you. Please keep those questions coming on the chat if you guys have more. A couple more that I have on the list is there anything that we have to do, like talking to our PCP doctor first and getting any advice from the doctor before scheduling and taking the vaccine?
Yeah, good question. Great question. So if you don't have any significant health risk factors, so what do I mean by that? If you don't have any immunocompromised state like cancers, HIV, if you're not on chemotherapy drugs, if you're not pregnant, if you are healthy individual, or if you are an individual with common comorbidities like diabetes, high blood pressure, things like that, definitely you don't have to call your doctor. You don't have to. In fact, even with above conditions, you still don't have to call your doctor at all. You can definitely go ahead and get the vaccine. But just to be on the safe side, if you are considered as a vulnerable individual, if you have any of the immunocompromised states, If you have any unusual diseases, not common diseases, then yes, you may have to just touch base with your doctor just to make sure, because there are so many, a lot of things are in the gray zone when it comes to if you can give this vaccine to individuals with HIV, if you can you give this vaccine to people with multiple sclerosis, or if you have Bell's palsy. So a lot of things are in the gray zone. So if it's better to consult your doctor before you get the vaccine, just to make sure. Only thing is, I mean, if you are my patient, I would definitely say yes, go ahead and get the vaccine. But my job is to explain you that this vaccine is not well studied in these specific populations. So nobody knows how this vaccine would behave when you give it to these vulnerable patients. However, it is highly recommended for sure. So there is always risk in medicine. The way we treat patients is based on risk versus benefits. Anything that you do, any antibiotic that you give, any medication that you give, you always have risks. You always have side effects. But the way we look at it is, how about the benefits? Do benefits outweigh the risks or not? If the benefits are significantly higher than your risks, then yes, we will say yes. So in those situations, it's better to consult your doctor for sure. Yeah.
Got it. Thank you. The other question I have is, especially if we have parents who are visiting us here from India and their health situation is totally fine and they are eligible to get the vaccine. If at all they develop any of the after effects that you have just presented in the seminar, is it okay for them to stick to the regular Tylenol if they do that, or do they have to go back any specific medications for them?
No, good question again. So, even if you are from India, even if you're not a citizen, you're definitely eligible to get the vaccine. If you're above 65 years old, I definitely strongly encourage you to get the vaccine if you're above 65 years old and if you're from India. If you have any side effects, take Tylenol or ibuprofen. Start with Tylenol. As I said, take Tylenol. You can take 500 milligram tablet. You can take up to 6 tablets a day. So that's the maximum dose you can go up to. So you can technically take Tylenol every 4 hours. So you can take Tylenol every 4 hours, every 4 to 6 hours. And if you still feel like Tylenol is not effective, then you can even add ibuprofen on top of Tylenol. You can take Tylenol every 4 to 6 hours. You can also take ibuprofen. You can alternate Tylenol and ibuprofen. So start with Tylenol. If it is not effective, then also take ibuprofen as well. Take plenty of fluids. Expect to have these symptoms. So just get some rest for those 1 or 2 days and you should be fine.
Sure. The other question I have, this is just something based on the reaction I've seen in the community or the general public. There seemed to be some resistance on not getting ready to take the vaccine. Anything you want to throw light on that specific group of people or that side who are debating if I should go for the vaccine or not?
Yeah, definitely. Thanks for bringing it up. Actually, I should have put in the presentation. Excellent question. It's not general population. Interesting enough, when we first started vaccinating in our hospital, so we have a team of, in my own team, and I have a team of 22 doctors that report to me. In my own team, we have about 4 providers who did not take the vaccine. So I was surprised. I was shocked, actually. You don't want to get and we are seeing COVID-19 patients every single day, especially January was crazy. And now it's getting a little better, but we were seeing COVID-19 patients every single day. 4 of them still did not get vaccinated. So and obviously, people, doctors are normal individuals too. They have medical knowledge, but they are normal individuals too. So when vaccine first came into market, there were a lot of questions, a lot of doubts. Is this vaccine efficacious? We did not even give this vaccine to anyone yet. It was only under studies, under research. How would this vaccine behave in the community, in the society? And how would people react to it? So there were hundreds of questions in their minds. So 4 of our doctors did not get their vaccine in the first round. So they just wanted to wait and see. మిగతా వాళ్ళందరూ బాగున్నారా లేదా వాళ్ళు బాగున్నారా తీసుకొచ్చిలే. Just wanted to wait and see, if everyone else will be okay with the vaccine. So once they realized that, after the first round, in our hospital, after administering thousands of doses, there were zero reactions, other than common side effects. Nothing happened in the hospital. So then they realized, oh yeah, this is completely safe. So they took their vaccine. Pretty much the rest of the 4 providers, they actually took their vaccine in the second round. This was back in December, early January that I'm talking about. And we are in February. So we already administered millions of doses in the country, millions. So we have robust data already. This vaccine is completely safe. To be honest with you, this vaccine is much more safer than driving on an interstate. You have a much higher risk. When you're driving on an interstate, you're at risk of getting into an accident, especially if you're in India, for sure. If you're in India, getting vaccinated is much lower risk than driving on an Indian road. So the risk is much lower. I strongly recommend, I highly recommend COVID-19 vaccine. If you get COVID-19 if you get COVID-19 infection, the severity of illness, the risk of getting worse is much higher, and much higher than the risk of side effects due to vaccine. So the risk is really, really low. Very safe vaccine, highly efficacious. Without a doubt, everyone in the community must get vaccinated. A robust data is out there, so it is very safe. I highly recommend to everyone in the community.
Yeah, a funny thought flashed across my mind when you said the data is available. When the pandemic started, there is a data that's being published almost every day, the number of cases on COVID by state, by county, and the number of deaths. Is there anything that is being published on the number of count on the vaccines being taken and the cases that are being impacted? Is there any dashboard that is being published to general public?
Oh, I mean, you don't have live dashboard like a Worldometer. Worldometer, we used to get data every day. And every day you look up at number of cases, number of deaths. We don't have, I don't think we have live data like that, but yes, absolutely. Every side effect is closely monitored. Every side effect, every severe allergic reaction is closely monitored by CDC. We do have data available. CDC publishes the data very often. It's periodically they publish the data, but I don't think it's live that you can get the data every day. But at least once a week, weekly, you can definitely get the data. So as of now, it is still very safe. The reactions or the severe allergic reactions are very few. In fact, the slide that I showed, that 2.1 cases per million, 6 cases per million, that's actually based on the data in the community. That's not based on the data in the studies, but that's actually the data in the community, because in the studies they did not give millions of doses. So data, that the slide that I presented, that's actually the live data. It's not live, but very recent data. I think the data was from last week.
Got it. Thank you. A couple more questions that these are just something I prepared. First thing is the different strains that we are having on the COVID. Is there a relation or a study that says that if we got COVID already, would a new strain impact the same person again for COVID?
So, as I said, it depends on the type of the strain. Both Pfizer and Moderna, they both were studied. They both were studied and proven that they both are effective against the UK strain. So if you have UK nowadays, UK strain is really worse in the state of Florida more than any other state in the country. So we are hit more. Florida is hit more than any other state with UK strain.
Okay.
Luckily, these vaccines, both Pfizer and Moderna, they are effective against UK strain. However, both the vaccines, they are not studied against all the strains yet. So what they do is typically, as they identify newer strains in the country, like in the United States, as they identify newer strains, they send these strains to Moderna and Pfizer, they ask them to do the studies in their own labs and give report to CDC. So as they identify newer strains, they do send them to Moderna and Pfizer. So as of now, it's only 2 or 3 strains that were studied. The UK strain, South African strain, I think there is one more strain. That's all that were studied, because these are the strains that were identified in the United States. The rest of the strains, they're not in the United States. They're not as prevalent in United States like as they are in other countries, especially in Asian and European countries. So there are, oh my God, I mean, nowadays there are so many. Every day they come up with a new strain. So we don't have all those strains in the United States yet. But if there are newer strains, as soon as CDC identifies newer strains, those strains are sent to the vaccines. They ask them to test. And if they are not effective, then yeah, they may have to alter their vaccine or come up with new vaccine. They may have to do something else. But as of now, it's a UK strain that's really more prevalent, and both the vaccines are effective against it.
Got it. Another question that we had was, let's say a person was tested positive for COVID and they came after 14 days, they're totally fine. Is there anything that you recommend them doing, a general physician checkup that, hey, I was tested positive for COVID, I'm doing fine, just a quick checkup that would help me tell that I'm doing fine, something is wrong internally? Is there anything that you recommend?
So typically what we do is, it depends on the symptoms. So if you tell me, well, I only had some a little bit of sore throat, low-grade fever, it lasted for 3 days and then it went away, it was not bad at all, I really don't have to do any testing, because it was only like a mild infection. It's just like a mild flu. If you have mild flu, you don't even see a doctor. So I would not do any testing. But if you had severe symptoms, then yeah, usually I do investigate. But I would prefer to do those investigations while you have active infection, because if you come to me 2 weeks later, most likely everything will be okay. But just to be on the safe side, I might do some testing depending on the severity of the illness that you had.
Got it. Another question just came. People with age under 40 with blood pressure and diabetes have any initial priorities for getting a vaccine?
Yeah, unfortunately, as of now, not yet. So even if you're 64-year-old with hypertension diabetes or 30-year-old with hypertension diabetes, they all have the same priority. The vaccines are not open for this particular patient population yet. So as of now, it's still 65 years and older. And once every 65 year and older are vaccinated, then the next step will be individuals with risk factors like hypertension, diabetes. And at that time, I don't know if they would open it for anyone with hypertension, diabetes, or maybe 45 to 65. I don't know. But looks like, based on a few podcasts that I heard from the senior leaders, looks like they might open it for the entire population, whoever has risk factors like hypertension, diabetes.
Thank you. I've got another question. I'm going to read this verbatim without summarizing, in my opinion. Vaccine is a virus that is weak and not strong enough to do any damage to the human immune system, but rather develop antibodies that last for a life for a human body. Then why are people saying that when we got infected with a non-modified strong virus, that the antibodies last only for 3 months? How is that vaccine antibodies are better than the antibodies that are generated naturally by a COVID-19 infection?
A great question, actually, great thinking process. Whoever wrote that question, excellent question. So, first of all, the vaccines that we have here, Moderna and Pfizer, they're not even inactive vaccine. They're just mRNA vaccine. So they just carry a little bit of genetic information about the spike protein. It's not even the entire virus. mRNA is specifically only for the spike protein on the virus that's injected into our body, and our body reacts to the spike protein and mounts immune response against it, and that's how we build immunity. So the first question, so it's not even the entire virus. And the reason is, So with the natural infection, so the biggest challenge with COVID-19 has been, it was, and it has been, it will remain. Biggest challenge is the asymptomatic spread or mild infection. So nobody knows the exact percentage, but there are studies showing anywhere from 20 to 60% asymptomatic spread. So you have infection, but you don't know that you actually have infection, and you may be spreading this infection to others without even knowing that. It happened, it still continues to happen. In fact, even with COVID-19 vaccine, it can still happen. You may still have asymptomatic infection. You may still spread infection asymptomatically. It can still happen even after you receive 2 doses of vaccine. So the reason is, your virus is inside your body. The reason why you don't have any symptoms, because your body is not mounting any response to the virus. Your virus is inside your body, but your body is not mounting any response, and that's why you don't have any symptoms. However, you're spreading this virus actively to other individuals. So it is still happening, and the percentage is really high. It's not 1%, 2% or 5%. Studies have shown that it may be anywhere from 20 to 60%. There is asymptomatic spread. And that's because your virus is inside your body, but your body is not mounting enough response to the virus. That's why you don't have any symptoms and you're spreading the virus. Because your body is not mounting enough immune response to the virus, your immunity does not last longer. So as I said, if you have moderate to severe infection, I had a moderate infection. I had a COVID-19 pneumonia. So mine was considered as moderate to severe, actually. So when you have moderate or severe infection, absolutely, you will have immunity that lasts longer, at least for 1.5 to 2 years at least, if you have moderate or severe illness. If you have mild infection or asymptomatic infection, it means that your body did not really mount enough immunity against the virus. So your immunity may not last longer. So even with COVID-19 vaccine, that's why you need 2 doses, because with the first dose, your immunity response may be around 60, 70%, maybe a little bit higher. But you need the second dose, a booster dose. That way you have 100% immunity response. I think a Novavaxine is the first vaccine that's coming up with 1 dose vaccine, but I think their dosage is a little bit higher. They're giving a higher dose of virus particles into your body. That way your body mounts a response to the virus and you can build more immunity in your body. Immunity lasts longer. So that's the thing. The difference is because your body is not mounting enough response, enough immune response. Your body is not building enough immunity. That's why it does not last longer. And when you get a vaccine, you're giving enough dosage, enough virus particles into the body. That way your body reacts to the viral particles, and that way you're mounting enough immune response, and that way it lasts longer.
Thank you for the very detailed response there. Paparao Garu, did I miss any questions on the Facebook chat? Just double checking.
Yeah, there is a new question there.
Might have to refresh. Can you read it out for me if you don't mind?
Yeah. Is there any observation or study for a person receiving vaccine becomes carrier to COVID?
Excellent question. I think I kind of answered it briefly. So there are no studies. Nobody knows because it's asymptomatic spread. It's difficult to study. Both in the Pfizer and Moderna studies, they were not included, or they were not studied at least. So even after you get 2 doses of vaccine, you can still act like a carrier. You can still be a COVID-19 carrier. You can still be asymptomatic spread. You may still spread the infection asymptomatically. It can still definitely happen. And they were not studied in both the studies, both with the Pfizer or Moderna. So it can definitely happen.
Thank you, Doc. Any other questions? Please feel free to put them in the chat on either Zoom or Facebook Live. Let me just do a double check. Oh, I think I just got one. Yes. if a person is infected with COVID with mild symptoms, how long does the virus stay in the body with the vaccination? Is that person doesn't expose to get infected again? I
Uh,
believe the question is if they had mild symptoms, is there a chance that they would get infected again?
so, okay, so if they have a COVID-19 infection and if the initial infection is mild, is there a risk of getting COVID-19 infection again later? Good question. So, if you have a mild infection, your immunity may not last longer. In one study, actually, there were multiple studies, few studies that showed if you have mild symptoms, your immunity may last only 3 to 4 months. In some studies, the immunity lasted for almost 1 year plus. But if you have mild infection, immunity definitely does not last longer. So if immunity does not last longer, you're prone to get a second infection. So if you have COVID-19, even if you have mild, moderate, or severe COVID-19 infection, I strongly recommend you to get COVID-19 vaccination because nobody knows how long the natural immunity will last. Because the pandemic just started last year, the only studies that we have so far are 1 year worth of studies. That's all we have. So unless we have some confirmation, based on the data from prior pandemics. So, now this is SARS-CoV-2 virus. There are sister viruses that we had outbreaks in the past. So based on those studies, like the SARS pandemic, for example, we had back in 2003, and we had MERS pandemic that we had, or endemic that we had back in 2012, 2013. So based on SARS and MERS, based on those studies, immunity lasted for about 1.5 to 2 years. Natural immunity lasted for 1.5 to 2 years. So they expect even with SARS-CoV-2, with COVID-19, the natural immunity may last for 1.5 to 2 years. That's the expectation, but nobody knows yet because the pandemic is still young. We are still 1 year, few months into pandemic.
Thank you. I don't want to feel like I'm ignoring the next two questions. These were already covered, but I'll just do a quick recap so that you can also help them. First one is when is the vaccine open for all the general public? And the second one is should we take the vaccine every year once we get it for the first time? Will it be considered like another flu vaccine going forward?
Yeah, I think I answered, but briefly, to general public will be opened based on the priority. So right now it's 65 years or older is the priority, and once they are all vaccinated, then they'll open it up to general public. Actually, after that, it will be to individuals with risk factors like hypertension, diabetes, and after that, it will be to general public. But as I mentioned, I gave you few tips so you can. Wait at Publix, it still works. If you are there, if you go for groceries, go at the end of the, and just because you're going for groceries, you're there anyway. Just go and give it a try. Be there when the pharmacy closes. Just ask them. It does not hurt. Stay there for 10-15 minutes. Just ask them, hey, can I get a vaccine? You may get lucky, and you can get a dose. Once you get the first dose, they are obligated to give you a second dose. So that's the trick. So get a first dose, then you will get a second dose for sure.
And the other one was, will it be considered like another flu vaccine going forward?
Yeah. So it may happen. Nobody knows yet as of now, because newer and newer strains are just coming into picture. As we have more and more newer strains, and if the current vaccines are not effective against the newer strains, that might happen. So we don't know yet. As of now, it's still UK strain, South African strain. There are a few other strains that are tested. In the United States, it's primarily UK strain. And as I mentioned, Florida is one of the worst hit states with the UK strain, but both the vaccines are effective. However, down the lane, in the next few months, if we identify a few strains, and if these vaccines are not effective against these strains, that might happen, where we might end up taking vaccine every year.
Thank you. All right. We're coming up on time. It's almost 5:30. I'll see if I still have any questions, but if we don't, Dr. Praveen, thank you so much for taking your time today and sharing all the valuable information. I'm pretty sure I found it very informative and knowledgeable for me, and I hope the audience and TAJA members have a similar experience and they have some of their questions answered. Thank you so much for your time, but we're not done yet. Papa Garu, I'll quickly want to turn it over to you to share some of your experience and knowledge with our audience.
Okay, I think we lost Naveen there for a bit, I think. Yeah, so thanks, Dr. Praveen Cherupalli garu, for spending time with us and, giving all the information with all the busy time that you're at coming and helping TAJA with all the questions and answers. Thanks again. And I just wanted to also share with TAJA the upcoming events that we have, and we have events listed and published for 2021 from our committee. We have finished 2 events with Sankranti and now with this COVID vaccination awareness webinar. And we have 2 more coming up pretty soon, one next week. We're in the tax season, so we have a tax and estate planning webinar, that's upcoming here, which will be another important session for everybody to learn about tax planning and estate planning. So don't miss this important webinar coming up next Saturday from 4 to 6 p.m. And we also have Women's Day celebrations coming up, virtual Women's Day celebrations on Saturday, March 13th. And our Ugadi Sambaralu event coming up on April 24th on Saturday. So we have also listed all the other events throughout the year. Thanks for all TAJA members and the Telugu community helping us, with everything. Thanks, Praveen garu, and thank you all.
Thank you. Thanks, TAJA, for this wonderful opportunity. Thank you all.
Sure, sir. Thank you so much for your time.
Vaccine. Go get vaccine.
Yeah, thank you.
Thank you.
Thanks, everyone, for joining us today. Hope you have a good rest of your Saturday and have a good weekend. Thank you so much.